Okay, good morning class. Today we're going to do a teach back on a lot of important chapters from your pathophysiology textbooks today. So let's start first with the topic on blood flow, right? So when we're talking about blood, we talk about blood vessels, right? And as we said, what are found inside blood vessels are blood, right? They flow through the blood vessels. Can anybody tell me the two main types of blood vessels that you are able to see in our body? Anyone? Yes? Sarah? Arteries and veins, okay. These arteries and veins are blood vessels because they contain blood. But there's a big difference, right? Which one carries the oxygenated blood? Arteries. Which one carries the deoxygenated blood? The veins. So when you say deoxygenated, means the blood contains mostly what? Carbon dioxide, right? But whether they are arteries or veins, it doesn't matter because they have the same layers in their wall, right? So if I were to draw like this, right? A blood vessel is nothing else but a tube, right? T-U-B-E. This is the lumen where the blood will flow, right? So this is where the blood will flow, correct? And it has three layers in the wall. Can anybody tell me the innermost layer, class? It's called tunica what? Intima. And the innermost layer of the blood vessel. And what is found in that intima? It begins with letter E and ends with M. What? Very good. It's the endothelium. When you are young, you expect the endothelium to be what? It's very smooth, right? So when you're a baby and you're a 5-year-old kid or a 10-year-old kid, you don't have a lot of fat yet in your system. It's like a tube like this, and the wall of that would be what? Smooth, right? Unfortunately, as we get older, what happens to us? We have what? Fat deposits there. We're going to explain that later on, right? Now, what's the second layer? The middle layer. Tunica what? And what is found in the tunica media? Smooth muscles, correct? Now, do you know any significance for these smooth muscles? Now, what can muscles do, by the way? They can either what? Contract or... So when I say skeletal muscle, it's attached to the bone. When I say smooth muscle, they found in hollow organs, like stomach. They're found in the walls of the small and large intestine, but they are also found where? In the wall of your blood vessels, both arteries and veins. And they are found in the tunica media. What's the first letter of media? M. What's the first letter of muscle? M. That's how you remember things. So these muscles can either what? Contract. Just like when I bend my elbow, muscles contract, they become hard. Or when I release, the muscles become what? Relax, when they become soft. Same thing can happen here. Relax. What happens if the smooth muscles contract? You do what? You develop vaso what? Constriction or vasomuscle spasm or vasospasm. Right? Vasoconstriction. When they relax, what happens? Vasodilation. And when you vasodilate, make the big lumen much bigger, what happens with the blood flow? When the lumen becomes bigger, it will increase the blood flow, right? So there will be increased what? Blood flow. And in vasoconstriction, what happens to the blood flow? You decrease the blood flow. Now, what will be the effect on blood pressure when you decrease the blood flow, when you vasoconstrict? What happens to the blood pressure inside? High or low when you constrict?
High.
High blood pressure. And in real life, you can probably see that when you go to the garden and you find that the water pressure in the garden hose is what? Poor. In other words, the water will just... And what do we do at the tip of the garden hose? We put our fingers to make the lumen what? Smaller. And what happens with the pressure? Right? Instead of buying those water pressured jet pressure to clean the car, I just do that, right? They're very expensive. Okay? The pressure goes up. The same thing here. Now, what's the third most layer? Outer layer. Tunica what? Okay, adventitia. And what is found in the tunica adventitia, class? elastic connective tissue. And therefore, connective tissue, I just put CT to save on my ATP or energy, right? So it has a capacity to stretch. It can actually regulate your blood pressure, right? Especially in a young person like you and I. Okay, so whether it's an artery or a vein, it means the same thing. It means that they both have the same layers in the blood wall, in the wall of these blood vessels, right? Now the question now is this. What do you call a small artery? Arterial. What do you call a small vein? Okay. Arterial and a venial. A small artery is called arterial, a small vein is called venial. What is the blood vessel, the smallest blood vessel in the world that connects an arterial and a venial?
Capillaries.
Perfect, very good, Ms. Reyes. What's your name? Ms. Reyes, right?
Yes.
I like your name. Easy to remember, easy to spell. R-A-C-E. Okay. My name is also easy to spell. G-A-M-O. My name is Dr. Gamo. It is not Dr. Guapo, right? Why? What does Guapo mean?
Handsome.
Thank you so much, Ms. Reyes. You get an A in this class. Okay. I'm just joking, of course. The only person who said that I was handsome was my mom. When I was born, oh my God, what a handsome boy. After that, nobody else. Not even my wife. Okay. If I ask my wife, honey, do you think I'm handsome? Just keep quiet and smile. I'm just joking. I just want you to laugh at this time at 7:15 in the morning, right? So a capillary, therefore, connects an arterial and a venial. Now, where do you find capillaries? Everywhere in your body. Do you have capillaries in the brain? Yes, we do. Do you have capillaries in the muscles? Yes. Heart? Yes. Organs? Yes. All the parts of the body have capillaries. And I'll tell you why. What do you call the Krispy Kreme donut-shaped cell in your body? Red blood cell. It's a biconcave disc, right? Like a donut, right? Imagine this to be a red donut. And what does it transport? Oxygen and what? CO2, right? Here, it's oxygen, because as we said, arteries carry oxygenated blood, correct? And therefore, the red blood cell carries the oxygen, so it has a lot of oxygen attached to it, okay? This is the red blood cell there, oxygen. And in fact, I'll make this smaller because it's not supposed to be that big. Smaller, okay? Why? Because how many red blood cells can pass through a capillary? One or one? You're very good. One, of course. That's how small a capillary is. When the red blood cell goes there, it contains oxygen. Now, what is the capillary found in between what? What do you find here? Cells, right? It could be brain cell, it could be muscle cell, it could be a cell in the liver, hepatocyte, a cell in the kidney. Every organ are made of tissues, our organs are made of tissues, and tissues are made of cells. The basic structural unit of living organisms, correct? Now, apparently, these cells, what do they need to survive? Yes? What do they need to survive? Oxygen. And why do we need oxygen in our cells and in our body? To produce what? In the mitochondria. Without the mitochondria, without the ATP, we all die. Our cells die. Does it make sense? So that's the reason why we need oxygen. Because that is needed for oxidative phosphorylation within what? The mitochondria. Remember the Krebs cycle and the chemical reaction taking place within the mitochondria to produce ATP, which is the energy currency of the cell. Now, what is diffusion again, class? What we learn in anatomy and physiology is that diffusion is defined as the movement of substances from an area of what? High to low. From high to low. It has to traverse the wall of the capillaries and the cell membrane. Can it easily do that? Because, well, the cell membranes are semi-permeable membrane. They can allow gases like this to diffuse from high concentration to low. Is that a form of passive transport? Yes, it is. From high to low. Does not require ATP. Diffusion is a form of passive transport. Now, what is the cell? So the red bus now becomes empty. Why does it become empty? Because there's no more oxygen. Who do you think will be the new passenger here? What does the cell produce as waste? Carbon dioxide. In other words, there will be a lot of carbon dioxide within the cell. Now, because it's a waste product, do we need carbon dioxide in our body? No. That's why when we exhale, we get rid of carbon dioxide. When we inhale, what do we bring in? Oxygen, right? So carbon dioxide will diffuse from high to low. So who becomes the new passenger of the red blood cell, which I usually refer to as the red bus? Carbon dioxide becomes the new passenger of the red bus. So now the red blood cell is carrying CO2 in the veins, and of course the bigger veins, right? Does it make sense to you guys? Okay? So the bottom line therefore is that this is something we learn in anatomy, histology, and physiology. Yes, we do, right? Okay, so let's have a bird's eye view of what really happens in our body in terms of the cardiovascular system. We talk about blood flow, right? When we talk about blood flow, there has to be a pump. Can anybody tell me what is the name of this pump that pumps blood in the body? What's the muscular pump in the body? The heart. You know the heart is as big as your fist. Everybody do this. Make a fist and put that in front of your chest. Now that's how big your heart is, right? Like theoretically, the heart is behind the chest plate, which happens to be the sternum. It's bone here. So the heart is behind that, right? As big as your fist. Now how many chambers does the heart have? 4 chambers, right? Okay. Let's make a drawing of the heart here. I left my heart, where? In San Francisco, but now it's in LA, right? Particularly here where we are, in LA, North Hollywood. What divides the heart into 4 chambers would be the septum. It's designed to prevent mixing of blood. We don't want the blood rich in oxygen to mix with the blood rich in carbon dioxide, right? So what would be the chamber here would be the right atrium. This would be what? Right ventricle. This would be what? And this would be what? So if I were a patient, this would be the appearance. Which is this? My right hand, right chambers. Left hand, left chambers. Right chambers, left chambers, as if you're looking at a patient like this. What is the name of the valve? What are valves? They are found in the heart, right? They allow the blood to flow in one direction and prevent what? Backflow. Do you understand? The valve here is called tricuspid valve. What about on the left side? Mitral valve or bicuspid valve. Are you following me? Okay? Now, let's review. What blood vessels bring blood to the right atrium? Superior vena cava, and then what about the one below? Inferior vena cava. Vena cava means a big vein. Big vein. Now remember, all the veins in the head, the neck, and the upper limb. You see my veins here? Now, don't look at my beautiful brown exotic skin, but look at the green veins. Beautiful, right? The veins. All the veins in the head, the neck, and the upper limbs, they eventually go where? Into the superior vena cava, and that's where the oxygen that brings blood goes there. And what about the veins from below the heart? Abdominal area, the pelvic organs, the lower limbs. You go to the what? Okay, it's called inferior vena cava, right? Okay. And apparently, there are the veins from where? Abdominal area, lower thoracic, and lower limbs. Which includes your leg veins, right? Your leg veins, right? So leg veins, here, femoral vein in the thigh, and we call those veins as what? Saphenous veins, right? Okay. So apparently, all the cells here, remember what I said here? All the cells that contain carbon dioxide, those are the veins, inferior vena cava, and the right side of the heart. Are you following me? Okay. Sometimes we change the color of these veins as blue. Why? Because in most textbooks, blue represents what? Carbon dioxide rich blood or deoxygenated blood. So let's make this blue, 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 blue. My world is blue, okay? And this is blue because what? Everything on the right side is rich in carbon dioxide because they got the blood from the veins of the upper limbs and head and neck and superior vena cava. On the other hand, the veins in the leg, feet, lower abdominal area, thoracic, lower thoracic, goes to the inferior vena cava, and they are brought into what? into the right atrium. Now the blood flows into the right ventricle, passing to the tricuspid valve, which prevents backflow, allows the blood to flow in direction. And then there is a valve called what? Pulmonary semilunar valve, which is a pulmonary valve in the pulmonary what? Trunk. And what does the pulmonary trunk do? Let's just make it simpler. It goes, brings the blood where? To where?
To the lungs.
To the lung. Left lung and right lung. It's called pulmonary trunk, which becomes the pulmonary what? Arteries, right? Pulmonary what? Trunk. On both right and left. And essentially, I'm sorry, the pulmonary trunk is the main trunk here. Like a trunk of a tree. And the trunk becomes the right and left pulmonary what? Artery. Does it make sense, guys? And what does the pulmonary artery do? Bring the blood rich in carbon dioxide to the lung. What happens in the lung? Exchange of gases takes place. What do we do with the carbon dioxide? We get rid of the carbon dioxide by what? By exhale. And when we inhale, okay, everybody inhale. Then exhale. Everybody inhale. Please don't fart. Okay, I say you were farting. Okay. So when the blood is in the lung, it now has oxygen. How does the blood get back to the heart? Via the pulmonary veins, right? So let me change the color to red. Why red? Because now oxygenated blood contains what? Well, oxygen, right? It came from the lung. So from the lung, it goes back what? Pulmonary what? Veins. How did it go to the lung? Pulmonary arteries. There are two, one on the right and one on the left. What about the pulmonary veins? There are four. Two from the left lung, and then what? Two from the right lung. Okay? So 2 plus 2, it gives you 4 pulmonary veins. So the reason why they're red, because they now carry what kind of blood? Oxygenated blood. Okay? Now the oxygenated blood goes here, the left atrium, passing through the mitral valve, left ventricle. Then, what is the name of the valve in the aorta? Aortic semilunar valve. So let's make it easier for us to understand. I'll make another drawing here with the aorta alone, like this. From the left ventricle, what comes out from the left ventricle? The aorta. I make it red, right? So the aorta, it goes like this. What is the name of the aorta that is going up? Ascending. What is this aorta that forms the arch? Aortic arch. Because it formed an arch. And then of course, what do you call that part of the aorta that becomes going down to the thoracic cavity is called what? Descending aorta. And then it becomes what? Thoracic aorta, and then once it pierces the diaphragm or penetrates the diaphragm, it changes name because we are now in the abdominal cavity. Therefore, what is the name of that artery? Oh, aorta. Abdominal aorta. And we know that this abdominal aorta will divide into the right and left common iliac in the area where we find the iliac bone, right? So right and left common iliac. And we know that the common iliac class, what happens? Divides into two, external iliac and then what? Internal iliac. The external iliac becomes the femoral artery, right? The femoral artery becomes your what? Popliteal artery, tibial, and then fibular arteries, which now becomes your dorsalis pedis arteries. So you see the difference here. Everything on the right side is blue. Everything on the left side will be what? Red. Okay? So red, red, red. Why? Because everything on the left side of the heart is where you find the oxygenated blood. Does that make sense? Okay? The idea, therefore, is this. The foundation of nursing and medicine is always what? Anatomy. If you do not know these things, you will be, what is L-O-S-T? You will be lost. You won't be able to understand what the heck is Dr. Gamo talking about, right? I'm here to make you not just pass the nursing board exam, but to be the best that you can be. And how can you be the best that you can be? By learning a lot of things. I have been telling you to buy your own whiteboard and try to do what I do here. Do one follow one, make your own lecture or something like this, right? Okay? Do you understand? Is there any questions so far? Okay. So, let's deal with the pathology. Right? When you're dealing with, let's start with the arteries first, then followed by the veins. In the arteries, what is the term they use to describe the deposition of fat in the wall of the arteries? It's called, yes class? Atherosclerosis, right? Atherosklerosis. Spelling is very important to me. I don't like nurses to wrongly spell the terms because when you write something on the chart, it is reflection of you and me. Who was your teacher in Dr. Gamo? Did he not tell you how to spell atherosclerosis? Okay? Now, why is that important for you as a future nurse and for me as a practicing MD, right? What is the name of the blood supply to the myocardial cells or the cardiac cells, muscle cells in the heart? Remember, the heart is a pump, right? Remember? What is the blood supply to the myocardium? What is the name of that specific name of the artery that supplies blood to the myocardium? Does anybody know?
Coronary.
Very good. Coronary artery. You are right. Tatevic, right? How was Tatevic? The one at the back. What's your name? Marusian. Okay, the Tatevic is the one near the door. I get confused with these names. Armenian names are, some of them are the same names and then, you know. Okay, Marusian. What's the name of the artery?
Coronary.
How many do we have, Marusian?
2.
How many hands do I have?
2.
The answer is 2. What are they? Left and?
Right.
Left and? Right. Right and left. Okay, very good. So it goes like this. Goes like this. Now remember, an artery is an artery. It carries oxygenated blood. It's red. It came from where? The aorta. So what is the organ that gets blood first from the aorta? The heart itself. Isn't it amazing? The heart pumps blood what? To the other organs. For example, in the case of the left side of the brain, over here you have the common carotid and the subclavian, right? I'm only talking one side. It's more complicated on the right side. You have a brachiocephalic there. Where does the common carotid go? Internal carotid and external carotid. This goes to the brain, right? And what they call the arteries in the brain? Cerebral, right? So when the heart pumps blood to the aorta, to the left common carotid, then it goes to the internal carotid, then to the cerebral arteries of the brain, okay? I want you to follow the route. What do you call the arteries in the brain, class? What do you call the arteries in the brain?
Cerebral.
What does cerebral mean? Of course, when I say you are highly cerebral, it means you are very brainy. Why are you very brainy and smart? Because you come from what school? From this school, right? I always tell the same thing to my UCLA students. Smart UCLA students, smart West Coast University students, right? Because you are smart. It's a matter of becoming smart, right? You are already smart, you want to become smarter, right? Okay. So, make sure you understand all these things, right? So let's try to get rid of all these unnecessary things here. I get this word here, okay? You don't get confused. So let me just allow me to make this easier for you to understand, okay? Okay, now, when you have atherosclerosis, which simply means that in the wall, so in other words, every time the heart pumps blood, it pumps to itself. If only the heart could speak, this is what the heart would say. What do you think of me, stupid? Before bringing blood to the brain, I should get what? The blood first. Isn't it amazing? When the heart pumps blood to the brain, to the brain, guess who gets the blood first? The heart itself. When the heart pumps blood, it actually pumps blood back to itself. To what part of it? The myocardial cells, because cells need what? Oxygen, just like the brain, just like the kidney, right? Here, what is the name of the kidney artery? Renal. What about the liver on the right side of the body, right upper quadrant? Hepatic artery, right? What about the left kidney? Left renal, right? What about the spleen? Splenic artery, right? The bottom line, therefore, is that Every organ has an artery coming from the aorta, including the brain, liver, kidneys, and of course the spleen, and other organs, and other muscles, and even bones. All the organs and the cells in the body needs artery. Okay? Even the heart itself. Now, in atherosclerosis, the problem is that there is deposition of fat everywhere. Can it deposit here in the cerebral arteries, like this, on the wall? Yes. Can it deposit in the wall of the coronary arteries, like this? Yes. And what is the term used to describe the deposition of fat in these walls? What is the term called? The pathologic lesion that you find on the wall. The fat deposit is otherwise known as, it begins with letter P and ends with E. Who said plaque? What is your name? Diana Nieves? How do you spell plaque, Diana?
P-L-A-Q-U-E.
Very good. Are you prepared for the quiz today? I can tell. Out of almost 20 people, you're the only one who gave me the right answer. Or maybe the people were just shy to give me the answer, or they don't really care. They know the answer, but they don't want, they pretend not to know. But you know, you gave me the right answer, right? Plaque. That plaque there is what? A recognition that you're going to die. A plaque of this plaque is given to the heart. It recognizes. I was kidding. What would happen there if you have fat deposit here? What happens to the blood flow?
Decrease.
Decrease. And what is decreased blood flow called? Ischemia, right? Does that make sense? Ischemia. That's why I call it ischemic heart disease or atherosclerotic what? Atherosclerotic heart disease, because the pathology is atherosclerosis, which is defined as a deposition of fat in the wall of the arteries. It could be here, it could even be in the aorta, fat deposit there, or even the subclavian here in the neck. It can also be known as coronary artery disease. So if you have decreased blood flow there, what will be the manifestation of the patient? They will complain of what? Chest pain. What's another word for chest pain? What's another word for chest pain?
Angina.
And what is another word for angina pectoris? Pectoris means chest. Pectoral is major muscles, right? So if I have chest pain, especially if the pain is found retrosternal, which means heavy, behind the sternum, radiating to the left shoulder, left upper arm, left forearm, hand, and jaw, could that be a chest pain due to cardiac origin? Yes, it could be. Do you understand? Okay. Will you be alarmed? Will you send home the patient? No, you don't. Why not? Because he could be suffering from angina. Now, are the cells dead here yet? They're not yet dead, right? Because there's just what? Decreased blood flow. I'll tell you the difference later on, okay? So, here you have chest pain, right? Angina pectoris. Okay? Do you understand? Now, in your topic today, there are certain formulas that we need to know. What are these formulas that we need to know? One of them is called Q is equal to what?
P over R.
P over R. Where Q represents what?
Blood flow.
Blood
Flow.
flow. What about P? Pressure gradient or delta P. What does delta P mean? Delta. Change or difference. Blood will always move from what? High pressure to low. High to low. High to low. High to low. That's the reason why they move in that direction. There's always a pattern here. Now, why is it the blood eventually goes to the aorta? Because the pressure in the left ventricle is the highest pressure in the chambers of the heart. So, like for example, from the arteries, capillaries, veins in this direction. Why? Because high pressure, middle buffer zone, low pressure. And that's the reason why we have all these things. Now, why do I want you to memorize this formula and be able to apply? A lot of people just simply memorize formulae without understanding the application part. In the hierarchy of learning, you have to know how to be able to what? Not just memorize, but what? Rote memory, but understand what is the application of these and be able to apply and understand what's happening in their body, right? And be able to discern what is it for. So, what is the definition of resistance, class? What's the key word that you know? Q is equal to P over R. It's a what? It's a fraction. This is the numerator. This is the denominator. Resistance. Can anybody tell me what is the definition of the word resistance?
Opposing forces.
I like this lady. Opposing forces. What's the key word? Opposing. What's the second key word? Forces. In other words, if the blood flows this way, if you start to have fat deposits there, what will the presence of fat do? It will resist or what? Oppose the flow of blood. It's a force that will prevent the flow of the blood this way to make it stop. And it's an opposing force. That is resistance. Now, what about pressure gradient? The higher difference, the faster and more volume of blood flowing. For example, the blood pressure here and there is different, but it's higher and then lesser. So it will flow from high to there. Blood will flow from higher to lower, higher to lower, higher to lower. Now, what is the relationship in this form between Q and P? Flow and pressure. Direct or inverse?
Direct.
Very good. In other words, if you increase the pressure gradient or difference, there will be what? Increased blood flow. On the other hand, what about resistance? What's the relationship between Q and R?
Indirect.
Indirect or inverse?
Inverse.
Okay, it's okay, Ms. Reyes. It's called inverse, right? What does inverse mean? If you increase resistance, what happens to the blood flow? It goes down. It's inverse. On the other hand, if you lower resistance, what happens to the blood flow? It goes up. Does that make sense? That's right. Remember the one we talked about, vasodilation? When you dilate this, what happens? Less resistance and more flow. Now there is another formula I want you to learn. What is that formula? Class, what is that formula? There is a formula in book that says R, which is this, resistance, is equal to 8NL over pi R to the fourth. What does R represent? Resistance. What about N? N stands for viscosity. What about the L? The length of the blood vessel. And what about R, the small r below? The radius of the lumen of the blood vessel. Radius, as we recall, is half of your what? From here to here, diameter. What is half? In the middle and here. Radius, the entire thing is what? Diameter. In other words, radius is half of the diameter of the lumen of the blood vessel. But be it an artery or a vein. So what is R here? Radius. What about L? Length of the blood vessel. And what is N? Viscosity. What is the relationship between viscosity and resistance? Direct. In other words, increase viscosity, increase resistance, and if you increase resistance, what happens to the blood flow? There you go. Now, what would be an example of increased viscosity in the blood? Example would be what? Polycythemia. What is polycythemia? Increase the red blood cell count. It means it's more what? More red blood cell in the blood. That means the viscosity will be greater. Does that make sense? Will the resistance be higher? Yes, because that is now going to be directly relation, right? Direct relation. What about the length? The longer the blood vessel, the more resistance, the lower the blood flow. Because why? There will be more friction. The longer the blood vessel, as the blood travels through the walls of that particular artery. Does it make sense? Okay? Now, what about radius? This is the one that is the most important parameter that we have to learn. We said if you increase radius, what happens to resistance?
Decrease.
Why? Because the relationship is what? Inverse. Right? And if you decrease resistance, what happens to the blood flow? Increase. That's why when you vasodilate, what happens? You increase the radius. Vasodilate means what? It's because bigger like this. And when you vasodilate, you increase the radius. You decrease resistance, increase blood flow. Isn't that amazing? So imagine these to be what? a blood vessel like this. See? Decrease radius. If you increase the radius, right? Decrease resistance, increase blood flow. Remember the one in the case of the myocardial ischemia? Remember that? We talked about that, right? There's angina, there's chest pain. Now, is anybody familiar with the drug called nitroglycerin? Now, this drug is a vasodilator of arteries. In this case, coronary arteries. What will be the effect on the smooth muscles here? Will they make it relax or relax? Okay, when the smooth muscles relax, you have vasodilation, which I explained a while ago, right? If you were paying attention. And when you vasodilate, what happens to the radius? Increase, then effect on resistance will be decreased. Decreased resistance means increased blood flow. That's the reason why these drugs can relieve what? The chest pain. The chest pain could be gone because why? The drug was given. Now, can you give this drug under the tongue? Can you give this drug on the skin, on the chest plate here, skin? Why would they be effective? How is it possible for this drug to reach the heart, particularly what part of the heart? Can this drug, when you put them under the tongue, can they jump to the heart? They know. What is found in the blood vessels here? There are blood vessels in the tongue, under the sublingual. Sub means below, lingual means tongue. Apparently, there are blood vessels. What kind of blood vessels? Here. So the medicine will now be what? Here, travels in the blood vessels all the way to the superior vena cava, because it's the tongue. Superior vena cava, then what? Right side of the heart, then to the lung, and then back to the heart, and then from the heart to the aorta, and then from the aorta into the coronary arteries, making them what? Vasodilate, increases the blood flow, then there is no more chest pain. Are they effective drugs? Yes, they are. Same thing with the skin here. What do you find in the skin? Just like in the blood vessels here. There are blood vessels here too in the skin, right? These blood vessels are called capillaries. So the capillaries, the same thing, would now travel into the vena cava, and then where? The right atrium. The drug will now travel to the lung, back to the left side of the heart, and then from the left side of the heart, that ventricle, aorta, the same thing. That you can also give it orally, but it'll probably take a long time because it has to go to what? The stomach, right? Does it make sense, guys? Is that important? Now, so this is going to vasodilate the coronary arteries. It will increase the blood flow, as I already explained. Why? It will relieve the chest pain. But the problem is that as a nurse, what are you expected to monitor? What happens when you vasodilate on the blood pressure? Yes?
The blood pressure goes down.
It drops. It's called hypotension. The question now is, as you take this drug called nitroglycerin, the effect is not just on the coronary arteries, but can it also affect the other arteries of the body? Yes, because it travels everywhere. It's in the blood. You have a maximum level of concentration in the blood, right? Or minimum to maximum. The question now is, if you vasodilate the arteries in the limbs, what happens with your blood pressure? It drops. That's the reason why whenever we give this drug, we tell our nurses to monitor the vital signs, particularly the blood pressure. Let's say, Dr. Gamo, at 6 a.m., the patient complained of chest pain. You ordered me to give nitroglycerin, PRN means as needed, and watch out for hypotension. Why? Because if I gave a drug at 6 a.m., after 10 minutes or 15 minutes, the drop, it was significant. From 120/80, it becomes 90/60. Will you call Dr. Gamo? That's me. Yes, Dr. Gamo, I'd like to inform you that the patient's blood pressure dropped from 120/80 to 90/60. So there are two things that you can do. Either one, I can tell you to lower the dose instead of maybe 10 or 5 milligrams to 2.5. Then I can also tell you we can probably stop it if it continues to drop. Does it make sense? Okay? Do you understand what we're trying to show here? Okay? So, that's the reason why we need to understand the importance of these, right? Nitroglycerin, a vasodilator drug, but it has its own side effects, right? So this is now atherosclerosis. Are we going to let the patient lower their amount of fat intake? Right? Look at me. What is here? I used to have a 6-pack, but now it's 1 pack of fat. Am I at risk of heart disease? Yes. I do not exercise. Instead of taking the stairs, I use the elevator. I'm a lazy person. And guess what? I go to Panda Express. Oh my God, the beef, the pork, and the shrimp. They all tell me when I stand in front of them, they talk to me and say, take me, take me. How can I say I resist the temptation? Resistance is gone. When I came here in 2002, I was 140 pounds. Now I'm 205 pounds. Thank you, America, for making me gain weight. I will die soon. I'm just joking. I don't want to die yet. My kids are still in college, so I need to live for them, right? So the question now is this. So you have fat deposits there. So to lower the cholesterol level, remember the HDL versus LDL, high density lipoprotein, the good cholesterol, and what's the bad? The low density lipoprotein, right? So the bottom line is that dietary restriction, exercise, at the same time, monitor your weight. So every time I use the elevator, tell me, Dr. Gama, you use the stairs. I need to have a measuring tape every time I come to class. I should be able to, every week it should be what? Lesser and lesser, okay? Because of that, right? Now, the question is, and this will be a topic next week, I might as well go ahead with this. When you're dealing with arteries like this, is it possible that eventually the myocardial ischemia becomes myocardial infarction? What is infarction? Necrosis, tissue death, right? What will happen here is that the muscle could be dead. How? Very simple. As time goes by, God forbid, not me, a patient like has a lot of fat deposits there, they have chest pain. They go to the ER. It's not MI yet. What's the difference? In MI, this is a big difference. As time goes by, what happens? Fat gets bigger and bigger and greater. There will be decreased blood flow, and when the blood flow becomes decreased, the blood also becomes what? Slower. And when the blood is slow, you form a blood clot, right? Right. Now, what do you call that clot if it's attached to the wall? Thrombus or thrombus? It's a stationary clot, right? The thrombus or blood clot, what does it do? It completely blocks what?
Blood flow.
Completely blocks the flow of blood. Zero blood flow, zero oxygen. Zero oxygen means MI. These areas will die. Guess what? What kind of necrosis would that be? Fat necrosis, liquefaction necrosis, crustacean necrosis, or coagulative necrosis. Then what does coagulate mean? To form a clot. So what caused the blockage of the blood flow in the coronary arteries is the presence of two things. Fat and clot. Oh my God, they rhyme. Fat and clot, you die. Right? Does that make sense? So can ischemia eventually lead to infarct? Yes. Which is more life-threatening, ischemia or infarct of the myocardium? Infarct. In fact, MI is your heart attack. For layman's terms, but we are no longer ordinary people. You are special people. You are nurses. In the medical world, we don't say heart attack, we say myocardial infarct. AMI, acute myocardial infarction. Does that make sense, class? Right? Do you understand? Now, when you have a blood clot, you probably read about this in your book. There are many drugs to take care of blood clots in the body. One of them is called anticoagulant, exemplified by your what? Heparin and your warfarin, otherwise known as Coumadin. What do anticoagulant drugs do? Do they dissolve the clot or they prevent further clot formation? You're so smart. They prevent further clot formation. What about your thrombolytic drugs? Lytic means breakdown. So do they break down and dissolve the blood clot? Yes, they do. So drugs such as what? Streptokinase, albokinase, urokinase, and of course the new in the market called gamokinase. I'm just joking, of course. I have a dream to put up my own drug company, okay? I just get them from China and India, and there you are. Bang! Repackage it, change the name to gamokinase. Okay? I'm a businessman. Now, the problem here is that if you want to dissolve the clot, it should be given in the proper time. If you have a complete block of the coronary arteries, they say the best time is within the first 2 to 3 hours, or even the first hour. Anybody with chest pain, what do people if it happens at 12 midnight, what will the husband tell the wife? Honey, it's okay. Just bring me tomorrow to the emergency room. When you wake up at 6 in the morning, your husband is dead. In rigor mortis. So what is the moral lesson here? Anybody with chest pain, are we going to wait? Bring right away where? The emergency room, because they can be helped by what? A thrombolytic drug. What does this drug do? Dissolve the clot. And the golden period of treatment, the onset of action will be the first 3 hours. If you were my wife, if you were my father, my mother, my brother, my sister, whatever, I would bring you right away. I don't want to wait. Do you understand? That's why if you are thinking of buying a house, always buy a house near the hospital, 1 block away or 1 house away. What you need to do is push the child or your brother, your father. Time is of the essence here. These muscle cells will not wait. The heart will not wait. It will die. And when they die, you die. You will rest in 6 feet under the ground. Permanent residence at Forest Lawn Cemetery. Right? You understand? Now, so do you understand the difference in this drug, right? Does that make sense? Is that clear to you? Now, what about veins? You said a stationary clot is called what? A thrombus. What is a traveling clot? An embolus. Now, have you heard of the word thrombophlebitis? It's probably mentioned in your book, phlebitis. The word phlebotomist, they get blood from the vein, right? Itis means inflamed veins. What is thrombus? A stationary clot. Now, what causes these to form in the leg veins? Lack of movement, lack of exercise, right? In the leg veins, they form the wall, especially elderly patients in the nursing homes. Why are they not exercising? Why are they not standing and walking? Because they're depressed. Why are they depressed? My daughter, my son is not visiting me. The last time he visited me was 1 year ago. I just want to die. And if the nurse tells them, oh, I don't want to exercise, I'm just going to lie down here in bed, I just want to die. So if you do not move, lack of exercise or movement, can you form a clot in your leg vein? You sure can, right? Now, what are the cardinal signs and symptoms of inflammation, like thrombophlebitis, itis with inflamed, is what? Number 1, rubor. What is rubor? Redness. What is dolor? Pain. What is calor? Warm. And what is tumor? Swelling, increase in size. So when the nurse is being told by the patient, nurse, I have leg pain, will you be alarmed? So what would be the first thing you would do? Anyone? I'm going to hire you now. You're hired. You will examine the leg. If I say I have leg pain in my left leg, am I going to examine the right leg? Leg pain first, leg, and then compare. And you get to examine the right leg later on, compare. So normal leg, abnormal leg, there's leg pain on the left, compare the right leg. So what do I do? Examine the leg. What are you going to look for? First thing, ocular inspection means you see the eye. A, this patient said there is redness. I take a look at redness. Is that what, a symptom or a sign? It's a sign. And then what's next? Tumor, swelling. And then what is calor? I have to what? Use my fingers to palpate, touch that area that is red. Is it warm? It could be inflamed. And dolor, pain scale from 0 to 10. How painful is it? 5. If it's very painful, 9 to 10. Do you understand? Okay? Now, question is, this could have been prevented if only what? We did exercises. That's the reason why one of your roles as nurses to do is what? Range of motion exercises. Exercise the leg. Calisthenics, you know. Dancing would be good. Walking with a walker is good. Walking. Does that make sense, guys? Okay? Now the question is this. Unfortunately, despite our heroic efforts to make them exercise, they don't follow instructions, or, well, they still develop thrombophlebitis. Are we going to exercise the leg if they already have evidence of thrombophlebitis? The leg is red, it's warm, painful. Are we going to exercise that leg? Yes, my dear, why not? You're shaking your head.
Trouble?
You will be in trouble? What kind of trouble?
No, it can travel.
Okay, I thought I had trouble. Oh, you are right, trouble. And where does it go?
Up to the lungs.
Why? Okay, no, you know, you're familiar with GPS, right? Global Positioning System, okay? Same thing here. If you have a GPS with you, it's called GAMO Positioning, I was kidding, GPS. I'm here to guide you how to learn, right? It starts with the leg vein. So let's see. Remember the GPS? Make a right turn at Victory Boulevard. Make a left turn at Bellingham. and there's an accident there, avoid that accident. Did you see that accident there?
Yeah.
Oh my God. So if this were a leg vein, go straight to what? Inferior vena cava. Then where? Right atrium. Then where? Now why did it not stop at the right atrium and the vena cava? They're big blood vessels and chambers. Right ventricle, the same thing. What about pulmonary trunk? Big trunk, it will not stop there. What about in the lung? Why would it stop in the lung? What do you call the tiny vessels in the lung?
Capillaries.
And what do you call the capillaries in the lung?
Bronchos.
What do you call the capillaries in the lung? What do you call the capillaries in the lung? What do you call the capillaries in the lung? It begins with letter P and ends with Y. Oh my God, of course! How can you forget? Because what does pulmonary mean? What does pulmonary mean? Don't you love anatomy and physiology? It's so KISS, keep it simple, smart student of UCLA, UCLA and both West Coast. You see what I'm saying? They have to stop where? In the lung. Why? Because what capillaries are able to allow to flow only one red blood cell. So what happens to the blood clot here? The blood clot gets trapped. If only the blood clot could speak, the blood clot would say, OMG, what the heck? Help, help, I'm trapped here in the pulmonary capillaries of the lung. I can never go where? To the other parts of the body. Now, you are the sister of this young lady here. What would make you think that this patient has pulmonary embolism? What used to be stationary clot in the wall, attached to the wall, became this clot because you exercised the leg, it traveled to the lung, and got stuck in the pulmonary capillaries. So what do you think would be the manifestations of the patient manifesting with pulmonary embolism in here? So these are the things you need to know because you want to pass the nursing board exam. Be the smartest person in the world, right? And in the entire universe? Yes, you are. Ask now. How would you know that this patient is suffering from pulmonary embolism? It involves what organ? We say pulmonary, what organ is involved?
Lungs.
Lung. So therefore, there's now clot in your pulmonary capillary. They were not supposed to be there. But you exercise the leg, you cause it to go there. How would you know that it's there, your pulmonary embolism? What would be the signs and symptoms of your patient?
Chest pain.
Very good. A symptom. So you exercise the leg and sudden onset of chest pain. What is chest pain? What is chest pain, right? What else? Because where is the lung found? In the chest. Just like the heart. See the big difference? Heart and lung causing chest pain. Here it's going to be the lung causing the chest pain, not the heart. What else? Yes, the lady to your back. Yes, you, my dear.
Me?
Yes. I forgot your name. What's your name? Mary, yes.
What was the question?
Aside from chest pain, what else would the patient manifest with if they have pulmonary embolism?
Trouble breathing?
Yes, it's called SOB. What does SOB stand for? Son of a bitch. Oh, shortness of breath, right? Joke only. I apologize to the people just to make you laugh, right? I want you to make learning fun. Shortness of breath. Otherwise known as dyspnea. Dys means what? DYS. Difficulty. Pnea. Breathing. PNEA. When you say apnea, no breathing. A means without breathing, right? Dyspnea means what? Difficulty of breathing. So if I have chest pain, I can't breathe, I can't breathe. And I could be suffering from what? Pulmonary embolism. Is that life-threatening?
Yes.
Is that going to come out in a nursing board exam? How many of you like to pass a nursing board exam? All of you, right? Why? Because you want to pay your student loans. 150,000 I heard, right? Well, if you want to borrow money from me, I have none. I'm a poor man. But you need to be smart to pass that. Why do you want to pass a nursing board exam? Because you want to get a license. A license to kill or a license to save? Save lives. You have to be smart, right? Okay? So, time is of the essence. We need to give a thrombolytic drug. Does that make sense to you guys, right? Okay, now. So, we heard about the possibility of pulmonary embolism. Because the clot formed where? On the leg veins, in the vena cava. Now, what about if the blood clot is formed here? Still pulmonary embolism. Because it goes to the lung. Now, how is it possible for a clot in the heart to go to the brain? Where should the clot be? Right side or left side of the heart?
Left side.
Of course. Does it make sense? If you form a blood clot here, the blood clot can travel from the left ventricle, or either left atrium, left ventricle, then aorta, then common carotid, and then where? Into the brain. That you end up with a stroke. Anybody assigned to talk about strokes? Who's the group assigned to talk about strokes or CVA? There was a group assigned to do that, right? Nobody was assigned to talk about strokes? Come on, you really forgot your topic? Were you the one assigned?
It was us.
Well, yeah, I know. And that is called, what kind of stroke would that be? Cardioembolic strokes. Now, it's possible to form a clot here when you have what? What is atrial fibrillation, or an abnormal rhythm, right? Remember, the heart is what? Normally beats like this. So when there is normal pumping action, there is no time for the blood to clot, right? But what happens when you have an arrhythmia? You know, like that. So when that happens, and there is that 2 or 3 millisecond gap, the blood is not moving at all, the blood will clot. If you don't believe me, go to the house, get a knife, sharp object, cut your blood, put it in the container, let it stay, it will clot. No, I'm just joking, of course. If you don't move blood, remember, it coagulates. If you put it in a container and keep on moving it, makes in liquid form all the time, right? So in other words, what I'm trying to say, in your nursing board exam, you have to be very, very smart. If the blood came from the veins, it would have no choice but to stop where? In the lungs, right? If the blood clot was formed in the right atrium and right ventricle, it would have no choice but to stop in the lungs, because the blood clot started there. On the other hand, if the blood clot was formed in the left atrium, like atrial fibrillation, or left ventricle, the blood clot can travel where? To the brain. You end up with a cardioembolic stroke, paralyzed with half of your body. Can it also, the blood clot can travel to the kidneys and the other organs? Why? Because it's like your what? 5 north and 5 south freeway on the highways, right? Travels there, 5 north, 5 south. You have a choice. The blood clot can travel anywhere and everywhere. Do you understand? Is that clear? Now, will this come out in the nursing board exam? Or any medical board exam? Yes, it can. So be aware. A clot form here can only go where? On the right side? To the lung. A clot form here can either go to the brain or any other organ, because it can now be able to travel. They love to travel. They're the accidental tourists, you know. It's blood clot. Do you understand, class? So far so good. Now, there was mention about Berger's disease. Berger's disease is a condition found in young men who drink alcohol, smoke. How many of you, the young men here, smoke? Okay, if you smoke, they found out that these men develop what we call Berger's disease, B-U-E-R-G-E-R-S, or thromboangiitis obliterans. What does it mean? You develop gangrene. It turns from blue, becomes black, fingers and toes. And we have no choice but what? Amputate. So go ahead, continue smoking. I'll give you a free amputation. I'm just joking, of course, okay? That's Berger's disease, right? So apparently when we talk about these things, Berger's disease, I talked about, now what's an aneurysm, by the way, before I forget? It's the ballooning of what? Of the wall of an artery or aorta, like abdominal aortic aneurysm, or it could be where? In the brain. Okay? So people with recurrent headaches, when you suspect the possibility of an aneurysm, if you go to the doctor with a headache, the most common diagnosis they give you is what? Migraine. That don't believe that, I'm just kidding, I'm not saying you don't believe your doctors, but get a second opinion, a third opinion. The best people to talk to would be people who are experts on headache. We have what we call headache clinics. When I was a medical student, we always refer our patients to the headache clinic headed by neurologists, brain experts, because why? If you have an aneurysm, what happens? The wall gets thinner and thinner. There are 2 types: acquired, like if your blood pressure is always high and not controlled, or congenital, you were born with it. Now I always share this example. Remember the mother of Bruno Mars? She was a Filipino migrant from the Philippines, came here, had married a Puerto Rican guy, and they have Bruno Mars. The mother just died 2 years ago. What caused the death of the mother? A ruptured aneurysm. How old was he? Was she? 57. How old am I? Oh my God, I'm 57 years old. Can I also die? So do not ignore recurrent headaches, right? In the cerebral arteries. Now, young athletes at the age of 18, can they develop congenital aneurysm too? It was there at birth. So don't ignore again. They play in the field, basketball field or what, they run, end up with that. Do you understand, class? Okay, is that clear? Okay. Now, we talked about, okay, so thrombus, embolus, the difference, atherosclerosis, obliterans, Berger's disease, and I talked about aneurysm. I'm just going over the study, guys, to make sure I've covered everything here. And of course, I talked about the formula here, about resistance and blood flow. There's one I forgot to mention. It will be discussed more in detail next week. It's called cardiac output versus what? Cardiac output is defined, if you remember, in your anatomy, is the amount of blood pumped by the heart per what? Per minute. Is equal to heart rate times stroke volume. What is stroke volume? You learn this in anatomy and physiology, the amount of blood pumped by the heart per beat. Right? On the other hand, amount of blood pumped per minute is cardiac output. Now, what is the relationship between these two with this? Directly related. Which means, if you increase heart rate, what happens to the cardiac output? It goes up. If you increase stroke volume, it also goes up. Now, there is another formula called blood pressure is equal to cardiac output times resistance, systemic vascular resistance. If you increase the resistance, what happens to your blood pressure? It goes up, just like what happens here in the resistance, right? If you have fat deposits here, you decrease the radius, increase resistance, because you decrease the radius here, what happens to the blood pressure when you increase the resistance? It goes up. That's the reason why we have hypertension among patients with fat deposits in the aorta. Does that make sense to you? Is that clear? Okay? On the other hand, when you exercise, what happens to the heart rate? It goes up. What happens to the cardiac output? It goes up. What happens to the cardiac output? Goes up. And what happens to your blood pressure when you exercise? It also goes up because of this formula. In other words, there is nothing that you cannot answer. And you need to be able to apply. It's just not a matter of memorizing this formula here, but be able to apply them in the real world. Do you understand? Okay? So be sure you understand those important considerations. Okay? Now, where do you find or produce your clotting factors? Where is it produced? Where? Oh, well, platelets are produced where?
In the liver.
Road bone marrow. What about clotting factors?
In the liver.
Of course. Why is it important to know that? Because if you have liver disease, will you be able to produce those clotting factors? You end up with what? Bleeding. Now remember, in order for the blood to clot, you need two things. Your platelet and your clotting factors. Like remember prothrombin and all these things? Thrombin. Does it make sense to you guys? People who drink a lot of alcohol, people with hepatitis B, liver failure, what happens? They have skin lesions manifesting as what? Bleeding manifestations. Why? Because they do not have enough clotting factors. Platelets are also important for clotting. You understand why, right? Okay. Now, the next topic is about, so platelet function has to be considered in terms of, if your platelet count is low, it's called thrombocytopenia. And if it's thrombocytopenia, guess what? The platelet is low, you could bleed to death. And what do you transfuse with? Platelet concentrate. Isn't that amazing? Is that clear? Okay. Now, anemia. Anemia is defined as a decreased red blood cell count, right? That's the opposite of polycythemia. Now remember, in the study of red blood cell, right? It's made up of, it has what we call hemoglobin. Globin means it has polypeptide protein chains, right? 2 alpha and 2 beta chains. 2 plus 2 gives you 4. And what is in the middle portion of these chains? Your what? Your heme. That's what you call heme. And globin protein, globulin. Heme means what? It contains the porphyrin ring. And what is found inside that porphyrin ring? There are 4 of them, right? 2 alpha, 2 beta, 4 porphyrin rings. It's called the heme component. It's where the iron is attached to. In other words, in order to produce red blood cell, do you need iron?
Yes.
Yes, you do. The question now is, what happens therefore if there's not enough iron? What kind of anemia would that be?
Iron deficiency.
What?
Iron deficiency.
Iron deficiency anemia. Is that the most common form of anemia?
Yes.
Yes, it is. Right? Okay. Do you understand? Okay. So in other words, in learning, let me just erase this. And as you can see here, can a whiteboard like this be used as a learning tool? Yes, it could be. If you go home, do what I do, hopefully you will not forget things. If you do it many times, 10 times, 20 times, right? So in the word anemia, decreased red blood cell count, you have iron deficiency. Yes, iron deficiency means you lack iron. You give iron supplements in the form of ferrous sulfate, right? Okay. What else? People with chronic kidney disease. Chronic kidney disease. What does the kidney produce? Very good. It's called erythropoietin. So when you have kidney failure, have you ever seen this patient in the DaVita dialysis centers? These are people with chronic kidney disease. They have two choices, either chronic dialysis or what? A kidney transplant. But waiting for the transplant, they have to undergo dialysis, right? The problem that you would encounter is that because the kidney is failing, will it be able to produce erythropoietin? No erythropoietin. What does erythropoietin do? It stimulates the red bone marrow to produce more what? Red blood cells. Now, if you do not have enough erythropoietin, what does Dr. Gamo give the patient? The synthetic form of what? What does synthetic mean? Man-made form of erythropoietin in the form of what? Are you familiar with those drugs? The Procrit, which is that synthetic form, right? E-poietin alpha. Okay? Isn't it amazing? You lack erythropoietin, what does the doctor give you? Erythropoietin, the synthetic or man-made form. Isn't it amazing? That's how you pass the nursing board exam. Just use your common sense, right? Okay? It's called critical thinking, right? Okay, now what about B12 deficiency? What kind of anemia would that be? What is pernicious? Lack of what? Intrinsic what? Factor. Okay? Now where do you find, so the intrinsic factor is produced by what? Does anybody remember?
Stomach.
Stomach. What cell in the stomach wall?
Parietal cell.
Parietal. I can tell you Ms. Reyes is studying. Parietal cell in the stomach produces intrinsic factor. And why is intrinsic factor very important? It facilitates the absorption of what vitamin? B12, otherwise known as cobalamin. Does it make sense? Okay. Vitamin B12, cobalamin, important for the absorption of iron, right? And B12 is also important in the formation of your red blood cell. Does it make sense, right? So B12, intrinsic factor, these are all important considerations that you have to think about, right? Intrinsic factor, B12 is important, right? Does that make sense? Okay. Now, of course, another form of anemia is hemolytic disease of the newborn. Have you heard about these? Hemolytic disease of the newborn is also known as erythroblastosis fetalis. Okay? And what is the meaning of these? Very simple. It happens in people who are what? RH. What is RH? RH stands for rhesus monkey. RH. Like me, I am B positive. What does it mean? I am type B blood and I am positive for what? RH positive. Okay. Now what is the problem in hemolytic disease of the newborn? The newborn child or baby will die. I'll tell you why. It usually happens when the mother is what?
Negative.
RH negative and the father is what? RH positive. They're not the same. Father is positive like me. I am the father. And my partner is negative. Is there a problem here? There will be. I'll tell you why. Of course, they have sex, the mother gets pregnant. The first baby is RH positive. First baby. So baby is positive, mother is negative. Is there a problem here? There will be a problem. Why? Because during the 9 months of pregnancy, right? 9 months of pregnancy. What protects the baby is usually the placenta. Right? But when the placenta, remember when the baby comes out, right? Remember this? Of course, I always show this as a demonstration. When the baby comes out, this is the vagina here, remember? Uterus, fallopian tube. The vagina is here, vagina here, vagina here. So when the baby comes out, push, 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 push. What does the baby say? Well, thank God, I'm the first baby. I'm safe. Why is the first baby safe? Why?
Because it didn't mix the blood in it.
Exactly. What happens is this. When the baby is coming out in the cephalic presentation, what comes next? The placenta. So this is the uterine wall. Remember the endometrium, myometrium, perimetrium. The baby comes out, there's the umbilical cord. How do you know the placenta is separating? Two things. Lengthening of the umbilical cord, which means the placenta is being separated. This is the reason why the umbilical cord gets lengthened. Second is a sudden gush of warm blood, because there will be bleeding. During the process of bleeding, when the placenta is separating, the blood vessels, the uterine arteries are now separated. Is it possible for the blood of the mother and of the baby to mix? And the moment the blood of the mother is mixed with the baby, the mother will develop what? Antibodies against Rh antigen, right? Who will form the antibodies? The mother. Against who? Rh antigen. But the first baby is safe because it's already out. Who will suffer? The second baby, both father and mother, another have a child, happens to be Rh positive. This is antibodies against Rh. Who will suffer? The second baby. Why? Because during the second pregnancy, there's no guarantee that the placenta can always protect the baby. And during placenta separate, the same thing could happen. What will happen? Mother negative, produce antibodies, Rh antibody positive. The baby is, antibodies against Rh present. And the moment they mix, for the second baby, remember the Star Wars movie? Enemy approaching. Enemy interceptors, immediate launch, release the antibodies, Shh, attack the red blood cell of the second baby, attack the red blood cell of the second baby. Is the red blood cell attacked? Yes, baby is dead. Oh my God. Why will the baby die? What do you mean by hemolytic? The red blood cell of the baby will burst. So the moral lesson here? The moral lesson?
Don't have a second child.
Only have one child now. Very simple. We can give ROGAM. What is ROGAM? ROGAM. GAM means gamma. Not me. Gamma globulin. Rh globulin means what? It's an antibody made by man. It's a form of what? Passive immunization. What do you mean by that? You give this antibody to protect what? The second baby. How? By giving this antibody to the mother will no longer what?
Make antibodies.
Exactly. You preempt the mother from, which is harmful. The antibodies injected or the antibodies formed by the mother? The mother's antibodies. By giving ROGAM, remember the word passive, you give antibodies instead of the virus, right? So passive immunization means giving ROGAM, if I'm not mistaken, 27th week of pregnancy. Week, I think in the previous video I said months, but it should be 27th week. And second, giving would be on what? During labor and delivery. Does that make sense? Now, what is the other moral lesson here? How many of you know your blood type? Who is blood type B here? B. Your blood type B. I better get your phone number because I'm B too. If I need blood, if I get an accident on the freeway. What's your name?
Daniel.
Daniel Frankel, right? Daniel Frankel, I'm dying. I'm suffering hypovolemic shock. I need your blood type. Now, if he wants to get an A, he gets it. Just kidding. I'm blood type B. Anybody who's blood B here? No one else. Okay, I don't need you anymore. Go home, okay? My wife is B, my kids are B, okay? I am their father, definitely, okay? Now, the point is, let's say you have sex with your partner, right? So you reserve for a hotel, and your partner and you are about to have sex, you're about to lower your underwear, and you remember, oh my God, Dr. Gamo told me, honey, are you blood type, are you Rh positive or negative? And your partner will say, I do not. Oh my God, abort. Honey, we'll do it tomorrow. There's always a time for everything. Sex can wait. Tomorrow morning at 7 o'clock, we'll go to the lab and examine your blood. If you're Rh negative, because I'm pretty sure I am Rh positive, and if you get the blood results by 7:05, we can have sex at 7:05. At least we know. And we have to tell your obstetrician, if you get pregnant, then we can tell. I'm just kidding, but you should have to. If they say heaven can wait, here sex can wait. Sex can wait, okay? Because if not, so you were right, I'm not kidding. Some couples do not even know that they have this problem. Guess what? First baby is okay, second baby is aborted. Why? Duh. Who killed the baby? The antibodies. Who? From the mother. I did not say the mother is a killer. I'm just joking, of course. I love my mother. Hi, mother. She's now in heaven, but can you imagine the emotional trauma and guilt feelings among the mothers? I killed my own daughter or son. No, it's not his fault. It's the father of. I'm kidding. Not the father too. He just gave the sperm. Do you understand what I'm trying to say? Okay. The bottom line, therefore, is nobody's fault. But somebody said, Dr. Gama, is that routine to check the mother and the father? I believe here in the U.S. it's routine, right? But in other countries, or sometimes you can just, probably forget to have it examined. So the bottom line is that if you do not know your blood type, you shouldn't even be nursing. I'm just kidding. Do you know your blood type? What's your blood type? You're O, universal donor, right? How many of you know whether you're Rh positive or negative? How many of you do not know? How many of you are Rh negative? You don't have to raise your hand. So if you know that you are, then you better be aware. You are in deep shit. Us too, okay? If you are Rh negative, for a woman who's Rh negative, I'll always remind myself, I am Rh negative. Every time you have sex with your partner, here, see? Rh negative. If I get pregnant, remind me to have that Rogam shots. I'm just joking. Do you understand what I'm saying, okay? Now, we talk about these things because we want to save lives, right? And that's the reason why we have to give Rogam. Get rid of my jokes. The important thing is that save life by doing the right thing, right? Okay? Now, in patients with leukemia, remember, what's the most common type of leukemia in children? Okay, acute lymphoblastic leukemia. What about the one with the Philadelphia chromosome?
CML.
Chronic myeloid leukemia, CML. And what happens in leukemia is essentially, why do people die? Because even though the white blood cell count is high to protect you against infection, but these white blood cells are what? Defective, right? They're useless. They cannot protect you against infection. It's the most common mode of exit, or how they die would be an infection, right? Okay. What about multiple myeloma? What is affected here? The bones, right? And what is it that is measured to determine the levels in what? What can we call those proteins? Benz-Jones proteins, right? So it's elevated, it could be possible multiple myeloma, right? We talked about that too, right? Okay. Now in hypersensitivity patterns, we talked about this. Why do you need to know these things? Well, as I said, right? Hypersensitivity includes what? Type 1, 2, 3, and 4, right? Hypersensitivity. Okay, type 1, type 2, type 3, and then what? Okay, type 1, type 2, type 3, and then what's the other one? Type 4. 3, 4, 2, 1. Either a concept map like this, you want to have organized information in your brains, or you can tabulate it, right? Okay. So what is type 1? What's another name for type 1? Immediate. Okay. What about type 4?
Delayed.
Delayed. Now what about type 2? Cytotoxic. What about type 3? Immune complex disease, right? Now which one involves the T cell, or T as in time out?
4.
Type 4. T cell. Okay. What about B cell? B cell. B cell. B cell. What do B cells produce? Antibodies, immunoglobulin. Here, immediate allergy, rhinitis, it is what? IgE. Here, M and G, and then IG what? G. Here, T cells are involved, right? Okay. You also involve here what? Mast cells. What do mast cells involve? Release histamine. That's why when you have an allergy, we give antihistaminic drugs. Does it make sense? Here, the onset of manifestation would be how many, minutes or hours?
Minutes.
Like how many minutes?
15 to 30.
15 to 30 minutes, same thing here, 15 to 30 minutes. What about type 3? 6 hours. What about type 4? 48 hours, 24 to 48 hours, right? It takes days. Here it takes 6 hours, but this is the fastest west. Okay? Example of type 1 would be what? So you have your allergy, rhinitis, allergic rhinitis, right? Anaphylaxis, right? Anaphylaxis and anaphylactic shock, right? And then what? Bee sting, when you have a bee sting, right? What about type 2? ABO what? Blood transfusion, BT reactions or blood transfusion reaction, right? That's the reason why, like I'm blood type B, should you give me A as a form of blood transfusion? I hate the A's. Anything that has what? Anti-B antibodies, right? The only blood I can receive will be what? B or O. Nothing else. If you give me an A, I could die. I have kidney failure, okay? Acute kidney failure. What else? Hemolytic disease of what? The newborn, right? Right. What else?
Graves.
Grave disease. Thyroiditis. What else? Myasthenia what? Gravis, where there's muscle weakness. What about type 3? Post-streptococcus what? Glomerulonephritis. What is that? When the kidneys glomerulus becomes inflamed, you have blood in your urine. It's called hematuria. But it is preceded, at least 1 week before the red urine or hematuria, you have the strep infection, streptococcus, in the throat. So watch out. And the other one is what? SLE. When you have what? Lupus erythematosus, systemic lupus erythematosus. As I explained to the other class last Tuesday, I said, my mom died at the age of 42 because of these SLE. This is the one that's the worst probably because it affects every single cell in your body. It even attacks your own DNA. Anti-DNA antibodies are produced. Brain antibodies against the brain cells. You have lupus nephritis, affects your kidney. Lupus dermatitis, you have butterfly rushes. You understand, okay? Now what about type 4? Tuberculin test, right? Remember the word PPD? The actual name is MANTOX, M-A-N-T-O-U-X, but what is injected would be the PPD or the purified protein derivative, which is part of the mycobacterium tubercle cell wall. Inject, you develop a reaction. What is the earliest time you can tell the patient to come back to read the readings in the skin? It will come, I'm pretty sure, it will come to the nursing board exam. 48 hours. If I inject at 6 in the morning of Monday, come back on Wednesday at 6 o'clock in the morning. Nothing earlier than that, okay? How will you know it's positive? 10 millimeter in diameter, and it should be elevated and raised, and it should be indurated. What do you mean by indurated? It's just hard. It's a reaction to the PPD. Now, what else? Contact dermatitis, right? What else? Did they mention about MS and Guillain-Barré syndrome, I think, right? Okay. The bottom line, therefore, is either concept maps like this, or come up with a table. Is also the fastest way to learn things. Okay? I'll give you a short 5-minute break, go to the restroom, and then we come back. Okay?